Hi, my name is Lori Floyd. I'm making this video as part of my NU607 Advanced Health Assessment class at Jacksonville State University, where I'm a nurse practitioner student. This is my volunteer who's going to help me with my video. And this video is for abdominal assessment and also musculoskeletal assessment. Hi, my name is Lori. Welcome to the clinic. What's your name?
My name's Katie.
What brings you in today, Katie?
I'm new here and I just want to get a healthcare provider.
Okay, well today while you're here I'm going to do an abdominal exam, also a musculoskeletal exam. So I've got my hands washed, gloves if I need them, and I've closed the door for privacy. Do you have any questions before we begin?
No.
Alright, I'll let you lay down with your head on the pillow so the patient's supine. I've got a pillow to relax the patient's head. Can you flex your knees for me? This will relax the abdominal muscles and let me perform my assessment better. I'll have the patient empty her bladder before she begins. Feel relaxed. Designate any areas of pain, so I'll assess those last, and also I'll be at the patient's right side for the assessment. Are you having any pain in your stomach today? Okay, so the abdominal assessment is inspection, auscultation, percussion, palpation last. So I'm going to start with inspection. I'm going to inspect the stomach for color to make sure the color is consistent throughout the patient's body. I'm going to assess for symmetry to make sure the stomach is symmetrical. I'm also going to assess for any venous prominences or superficial veins I can see. Venous flow above the umbilicus is toward the head, and then below the umbilicus, venous flow is generally toward the feet. So the patient's abdomen is symmetrical, no prominent veins noted, and color is consistent throughout the body. For inspection, I'm also going to assess for any abdominal masses, hernias, and protrusions. So I ask the patient to take a deep breath to bring the diaphragm down and compress the contents of the stomach. Take a deep breath and hold it. Okay, you can let your breath out. No visible masses, protrusions, or hernias. I'll also ask the patient to raise her head up just a bit to contract the muscles of the stomach. Okay, you can lay on back, and there was no visible masses, hernias, or protrusions, or any other abnormalities noted. Next, I'll move on to auscultation. I'll make my stomach into a 4-quadrant grid, start in the right lower quadrant, and move around the stomach and listen for bowel sounds. Bowel sounds are normally 5 to 35 sounds per minute. Clicks and gurgles are normal. Hypoactive would be less, and then hyperactive would be more, and then absent bowel sounds would have to be listened, auscultated for 5 minutes before they're called absent bowel sounds and maybe a medical emergency. So just breathe normally for me. Okay, bowel sounds are present and normoactive in all quadrants. I'm also going to listen for sounds over arteries, and my stethoscope is just one-sided, but I use the diaphragm to listen for bowel sounds. I'll use the bell to listen for artery sounds. I'm going to start with the aortic artery, and I'll do renal arteries, iliac arteries, and I also do femoral arteries. Okay, there was no bruits noted, and that's what we were really listening for, was any kind of turbulent blood flow noted throughout any of the arteries. And so those were normal, so that concludes our auscultation. We'll move on to percussion. I'll percuss over all the quadrants of the abdomen and then identify organs. So just breathe normally for me. General tympany noted over the abdomen, which is normal. Now I will come up from an area of tympany on the lower abdomen, mid-axillary line on the right side to identify the liver, and then come down from the lungs, so I have resonant sounds to listen for the sound to change to dull over the liver. Sound change to dull about right here, and then I'll come down from the lungs. And I had a sound change to dull about right here. Normal liver span is 6 to 12 centimeters, and if I had some tape or marking pen, I could measure that on the patient. And I'll also check for the spleen. Okay, the spleen's identified between about the 6th and 9th rib. The spleen area would be dull over the organ, but it's usually tympanic because the fundus of the stomach overlies the spleen and produces a tympanic sound. So that is my percussion of the abdomen, and then palpation of the abdomen. I'll feel for the abdominal aorta pulse, which should be, if it's a little laterally prominent, could indicate an abdominal aortic aneurysm, in which case we would not want to palpate that area. I'm also going to do light and deep palpation for masses or pain and tenderness, and also to feel organs. So I'm going to assess my aortic pulsation first. Very good. Pulse rate normal 2+. Now I'm going to do some light palpation. Tell me if you feel any pain.
Okay.
Any pain?
No.
And we're going to move on to deep palpation. I'm going to start around the umbilicus. Check for any hernias, masses, or protrusions. I'm also going to palpate the liver, which you can use the hook method. I'm going to do my left hand under the patient and right hand to try to feel the liver. If you don't care, put this arm up over your head. Take a deep breath in for me. Okay, you can let it out. The liver is not palpable. I also could have faced my hand toward the patient's head as another method, but liver is not palpable, and it usually is not palpable in the average patient. Also try to assess for the gallbladder. You can take a deep breath in. Okay, you can let that out. Gallbladder is not palpable and is below the margin of the liver. And palpate the spleen, which is, I'll be on the patient's right side and reach across to palpate the spleen on the left. Deep breath for me. Very good. Spleen's not palpable. You can let out. And I'm also going to palpate right and left kidneys. So right kidney from the right side. Okay, you can take a deep breath in. Okay, good. Right kidney's not palpable, and I'll also assess the left kidney. Take a deep breath for me. Very good. Okay, and the right kidney's not palpable, and these organs typically aren't palpable. So what we're going to finish up with is I'm going to let the patient sit up. Be good. And I'm just going to percuss the CVA for any tenderness back there that might indicate a pyelonephritis, kidney stones, things like that. Place my hand on the patient's back. I'm going to hit my fist against your back. It shouldn't be painful, but we should hear a thud, and but it should not cause you any pain, okay? Very good. Okay, very good. Did you have any pain? No. All right. So this concludes the abdominal assessment, and the patient was negative for any CVA pain. Now we're going to move on to the musculoskeletal assessment, and we do the body as a whole. We're going to do ours systematically when we come to each joint. And we're also going to do it bilaterally. If I don't do it bilaterally with our patient, I'll designate that we would do this bilaterally. So I'll see your hands. Okay, we're going to look at the front and the back of the hands. Look at the supine surface, the anterior surface. Look for any creases. Make sure the color is consistent throughout. Make sure the patient's hands are warm and no any swelling or redness. Let you flip your hands back over. So we're going to assess the joints of the hands. We're going to start with the proximal inner phalangeal and see if there's any pain or tenderness. Then we're going to move to the metacarpal phalangeal, any pain or tenderness, and then the radiocarpal groove at the wrist, any tenderness. Good. I'm going to let you squeeze my 2 fingers, assess for muscle strength, and now we're going to do range of motion of the hands. So without moving your wrists, just take your fingers, point them down to the floor, very good, and then back up as far as you can go, very good. I'll let you take your fingers, spread them out, and then back in, perfect. Now we're going to assess the thumb to each finger, thumb to the base of the pinky, very good. Can you form a fist? Very good. Now if you'll stick your hands out in front of you, we'll assess radial and ulnar movement. Can you move your hands in and out from side to side? Very good. And now we're going to assess your wrist, so you can bend your wrist down as far as they'll go and then back up towards your head. Very good on your hands and wrists. Now we'll move up to the elbow. So with the elbow flexed, we have the ulnar bone on this side, the radial bone on this side. Old-cranium process is behind the elbow, and then you have your medial and lateral epicondyles. So I'll let you start from extended position. Can you get your elbows out as far as they'll go? Very good. And then flex them up towards you as far as they'll go. Very good. And then arms out in front. We're going to supinate, and then we're going to pronate, and just rotate those. Very good. Good movement throughout. I'm going to let you flex towards yourself with some resistance. Good. And then down to the floor. Good. Muscle strength 5 out of 5. We're going to move up to the shoulders next. It's just the shoulder girdle. I'm going to let Katie shrug for me. Very good. And now without any cranial nerve 11 intact, which assess for that. Now we're going to do some range of motion exercises with the shoulders. So arms out in front, and then up above the head. Very good. And now arms out in front, reach behind the back. Very good. Arms to the side and reach up over your head. Very good. Arms still to the side, behind your back with elbows bent. Very good. And then arms behind your head, elbows bent. Very good. And then internal, external rotation. Can you take this shoulder and try to come toward this knee? Very good. And then the same with the other side. So we're going to do some of those same things again with some resistance and opposition to check muscle strength. So can you put your arms out in front, lift up toward the ceiling. Very good. Out to the side. Very good. And then down to the floor. Very good. Muscle strength 5 out of 5. So now we're going to do the face, the tempo mandibular joint. So I'll let you open your mouth and close. Very good. No clicking or popping. Any pain noted? Okay. Down the bottom of your mouth, outside to side. Very good. Protrude forward and then retract back. Very good. No pain? Okay. And also now have you clench your teeth. And it says the temporal muscle and also cranial nerve 5. So I'll let you stand up for me if you don't care. We're going to assess the cervical spine. So we have our bony prominence at the back of the base of our neck with C7 and T1, and that's where we get most of our movement from. So we're going to do chin to chest. Very good. Chin to ceiling. Ear to shoulder, both sides. Very good. And now ear to shoulder, and now chin to shoulder. Yeah, chin to shoulder. Very good. Now we're going to do some of these same things with some resistance, okay? So ear to shoulder. Very good. Ear to shoulder. Okay, chin to chest. Very good. And chin to ceiling. Very good. Also do some, push your shoulders up. Good. And then push my hand in. Very good. And then try to push my hand back. Very good. So also testing the sternocleidomastoid muscle and the trapezius muscle. Now we're going to assess the spine. I'm going to just do a little percussion with one finger. Any pain? Then use the ulnar side of my finger to also percuss. Palpate for any bulging or prominences. This patient it doesn't have any bulging or prominences. And now let's turn back around and we'll do some range of motion activities. So can you bend at the waist? Very good. Extend back from the waist. Okay, bend side to side for me. Very good. And then take your hips and rotate. Very good. All right, I'll let you sit back down. So that was our back. Also note the thoracic region convex and then the lumbar region concave. So I'll let you lay on back for me. I'll assess the hips. I'll palpate for any tenderness, instability, anything. Are you feeling any pain? No crepitus noted. Now we're going to do some range of motions with the hips. So I'm going to let you take your leg and pull it up to your chest. Very good. You put it back. Also at this time the patient would need to pronate and so she can hyperextend her leg, but I'm not going to make her change positions right now. Take this leg and move out to the side, back in and across the body. Very good. And this would be done bilaterally with the other leg as well. So full range of motions noted in the hips. We're also going to check her knees out. I'm going to palpate for concavities. And absence or abnormalities and concavities could indicate an effusion, but both knees are symmetrical. Palpate the popliteal area. All right, I'll let you flex both your knees up and in, and then extend out. Very good. Full extension and flexion noted. And I'm also going to let you flex your knees back again with your feet on the table, and I'm going to externally, internally rotate your legs, okay? Any pain noted? Range of motion full noted. So now we're going to do your feet real quick. If you could stretch your legs back out for me. Assess all the digits, assess color, temperature, any redness or swelling, and all the patients symmetrical and normal. So now we're going to do some range of motion in the feet. Can you pull your feet toward your head? Push your feet toward the floor. Push your feet out from each other and then toes back in together. Very good. And also now we're going to bend your ankles. And could you take the soles or the balls of your feet and turn them in toward each other and then out. And then we'll test muscle strength. Pull your feet toward the head. Push me to the floor. Okay, very good. Muscle strength 5 out of 5. So this concludes my video. Do you have any questions? Thank you.